to be cut from her home has highlighted the problem the NHS faces dealing with patients with obesity. Firefighters and engineers had to demolish part of Georgina Davis's home in order to get her out. She's now in hospital receiving treatment in Merthyr Tydfil.
Well, joining me now is the liver specialist, Dr. Oben, who runs a gastric clinic at St Thomas's. He's also a leading researcher in the field, and he was a key figure behind the obesity. He is a key figure behind the Obesity Action Campaign. Welcome to you indeed, Dr. Oben. I mean, how common is this kind of thing? I mean, obviously, a 60-stone teenager is pretty unusual, isn't it?
It is pretty unusual to have patients weighing that much, but actually obesity in the UK isn't uncommon. The population prevalence for obesity in the UK presently is about 30% and rising, and it's about 15% in children. The projection from the Foresight report, which came out a few years ago, says that by 2050, half of the UK population, 50% of the UK population, will be obese. Now, my patients are dying every day from obesity-induced diseases, including obesity-induced liver disease. We, as a nation, have to wake up and do something about this.
Now, what are the costs, though? I mean, obviously, the involvement of the emergency services in the case of that unfortunate girl, I mean, this must be pretty massive.
Absolutely. The costs are billions. I mean, obesity is costing the UK billions of pounds and is killing millions of patients. And as a result of this, we launched, at the House of Lords in November last year, the Obesity Action Campaign, precisely to bring awareness, to raise awareness of obesity amongst parliamentarians and amongst the general public.
But I mean, you see this as a sort of like tobacco, do you?
Absolutely. We have to be, cognizant that it is killing millions and
but
costing
food
billions.
per se is not bad for you, whereas tobacco is.
Very good. Food per se is not bad for you. Actually, that's not entirely true. It's how much of it
if you don't have it, you die.
Yeah, if you don't have it, you die. But if you eat too much of it, you also die. So you have this balance between how much you eat. No food per se is bad for you. It's how much of it you eat. If you're eating too much, clearly you will suffer heart disease, liver disease, pancreatic cancer.
So what degree of intervention do you think is, would be fair? Would be
very good. I think we need to intervene from pre-birth to adolescence and adulthood. There is emerging evidence that obese mothers may adversely program their offspring to develop obesity. So we need to be telling obese mothers perhaps to downsize prior to getting pregnant. And that's important because, as I say, the rate of obesity...
How can you, I mean, you can give people lots of advice.
Sure.
How can you actually encourage them, or is it a question of compelling them?
I think it's going to be difficult governmentally to compel them, but I think it's rather like making it difficult for people to smoke. You have to make it difficult for people to overeat. You have to make it difficult for people to become obese.
Now, just going back to the case of this girl.
Sure.
I mean, how could that happen, that someone could get? I mean, is it simply just a question of...
Sure. My overwhelming impression about this young woman is one of intense sympathy for her and her family. But obviously I can't really comment on an individual patient's case. Because
but I mean, how many people are there who are that obese?
Sure. If you came to my clinic on a Wednesday morning at St Thomas's Hospital, you would be astounded. I mean, I have patients who weigh 170 kilos, patients who weigh 150 kilos. My clinic is stuffed full to the rafters. I have the largest intergastric balloon practice in the UK at St Thomas's, and every week 7-8 patients we're putting balloons down into to help them to eat less and help them to downsize.
And that is really just down to eating too much, or is it a deep-seated psychological problem?
It's, the issues surrounding why or how patients get so big are obviously multifocal, but at the end of the day, it boils down to how much you eat, how much exercise you do. There's a simple equation. Too much energy in, too much energy out, your body will store it as fat. You will get obese.
And these people who get that obesity, do you cure them? I mean, do you get them back to normal body weights?
We can do. We have various means at our disposal. We get them to see counsellors. They get to see me as a gastroenterologist, and they also get to see my surgical colleagues. So we have, as I say, a multifocal approach. But the important thing, the Obesity Action Campaign, obesityac.org, we realise also that we have to, how do you say, pressurise government. It isn't just about us doctors. Rather like smoking. When I was younger, you could smoke on buses. Now you can't. It requires governmental action. Otherwise, we as doctors can't cope.
Dr. Oben, thank you very much.
Pleasure. Thank you.
You're watching Boulton Co. To read animal